Good evening, everyone here tonight. On behalf of SOMA and the Board of Directors, I would like to say a great and big welcome to all the interns and community service doctors that is attending this very important SOMA Free State branch interaction that we will have under the leadership of Prof Hagemeister. And I hope that we will have quite good feedback. And again, under the leadership of Prof Hagemeister, that understand a lot of the problems that you are facing, we would then be able to move forward with some great solutions and see how we can assist and help you all. With this a few words, I would like to ask the Prof Hagemeister to please continue the meeting. Thank you.
Yeah, Dr. Zinnik, thank you. Welcome again from my side. Welcome from the Bloemfontein side.
You are muted.
I should not be muted.
No, we can hear you.
You can hear me.
We can hear you. Yeah.
Can the chairperson hear me?
No, I think she's got problems with the sound on that side, so she won't be able to hear you. I'll just send her a message.
Okay, good. Oh, yeah, we are having this meeting tonight to give our young colleagues in the Free State province an opportunity to engage with us. Given the geography of our province, we actually now end up involving two different branches. That's owed to the nature of our branch structures, the geography, and I'll elaborate a little bit on that. I will also try to give a rather brief overview over topics that we have been engaged with and activities that we have been tackling. So just to give an initial idea of the Free State branch, as our branch is called, based in Bloemfontein, which is, as I said, not covering the entire Free State. There is the Free State Goldfields branch, and I understand that Dr. John Akinbohun from the branch council in Welkom will also join us and say a few words on that side. So our branch, we are having a branch office at the university campus of the University of the Free State in Bloemfontein, but we are effectively covering the geographic majority of the province. So the areas up far north to the Gauteng border, to the Vaal River, Kroonstad, and that are part of our branch. The sites in the Eastern Free State, also internship sites in Bethlehem and Puerto de Chaba are part of our Free State branch. And the Southern Free State, the Garib district, where at least so far there is no placement of interns happening. But yeah, certainly the community service doctors also addressed in tonight's meeting. There is posts and there's need. It's a rural area. So yeah, those are the geographic areas. The larger hospitals in that area include the academic and tertiary centers here in Bloemfontein, Universitas Academic Hospital and Pelonomi Tertiary Hospital. The Free State Psychiatric Complex in Bloemfontein, the district hospitals in the Mangaung area, National District Hospital, where I spent a lot of my clinical time, Botshabelo District Hospital and Jeff Moroka. But then also the smaller public sector hospitals in between, and obviously the regional hospitals, the specialist hospitals in Kroonstad, Boitumelo, Ditlabeng Hospital in Bethlehem, and Manapo in Puerto de Chaba. Obviously, we also have quite a few private hospitals in that area, from the centers here in Bloemfontein, the bigger ones, Netcare, Mediclinic, and Rose Park, but also Busamed now, and yeah, then the private hospitals also, in the Kroonstad and Bethlehem area. So that's basically on the facility side. Obviously, coming from a primary healthcare background, the GPs and also the doctors now increasingly that get employed in the primary healthcare services, in the day hospitals and in the public sector in that geographic area also belong to our area of responsibility. Which now takes me to some of the matters, as I said initially, I want to briefly address what we are engaging with. We have had a few labor relations issues. One of the challenges in this province that I would want to be rather frank about is a not too convincing industrial relations track record by my own employer, the Free State Department of Health, where we had a couple of engagements still ongoing up to a level where legal proceedings get initiated. Those things involve, for instance, the non-implementation of salary progressions. Our pilot case in that regard is the case of the registrars of the colleagues that are appointed as specialist trainees at Universitas Academic Hospital, and that have been struggling to get their appropriate salaries, their adjusted salaries according to their seniority in the posts. And those things are being addressed, those things are being pushed. We have had meetings on the institutional level, but also on the level of the Provincial Department of Health. In a similar notion, we had previous engagements at Pupilla House at the Provincial Department of Health around internship matters. We are trying to address shortfalls in terms of placement, and again, I must share that the way how many of the placements are being done in the Free State are not yet where they could and probably where they should be in terms of transparency, in terms of communication with the incumbents, and those are all matters that we have been addressing, but where we are also eagerly awaiting feedback and eagerly awaiting the input from the young colleagues to both hopefully get some positive feedback on improvements that happen. I haven't heard too much about non-payment of salaries. There is issues that we'll probably pick up on with Dr. Hussain a little later when it comes to employed doctors matters. But yeah, as I said, we are happy to be contacted, to receive information, and to be engaged, and if you wish, employed on your behalf to address these matters with the employer or with other institutions. And I may share with you at this point already that both Dr. A Hussain and myself are also sitting on the Health Professions Council's subcommittee for internship evaluation, which is the accreditation of the internship sites. So we have been visiting sites in other provinces. Dr. Hussain actually has been here in Bloemfontein with us on the last accreditation visit. So we do have some practical experience and some practical exposure, as well as to how the internship accreditation process is meant to work from the Health Professions Council side, where the notorious issues are, where complaints arise from out of other internship sites, and again, we'll be more than happy to share insights in that regard, to engage in discussions, but also to take up concerns maybe via that route on behalf of our young colleagues. So I think that's been quite a mouthful from my side on the Free State branch. I would like to conclude then with the comment that just now last weekend we also have had quite an engaged discussion on Salmagremia concerning the rollout of the vaccination, of the COVID-19 vaccination and the first experiences, and have been trying to identify shortfalls, but also possible solutions. Again, trying to do justice to the different stakeholders and members, and there the general practitioners, for instance, were one of the groups that felt that there were quite a number of questions still to be answered with this implementation. But I'll leave it to the further discussion then, to deepen on the one or other matter as the audience feels it would be necessary. Having said that, can I please hear whether Dr. Akinbohun, Dr. John is with us, and whether we can maybe allow him to briefly talk, if we can get him in there. I see him on the list of the panelists. John?
Thanks, Prof. Thanks for inviting me. I see that you have covered most of the things that affect us in this area. Where in our area here in Velcom, Goldfield area, where we want to highlight is our inability to attract specialists and other categories of medical officers, because our area is deemed as a rural area. Although we have a post for specialists, we don't quite get specialists coming to this area. So even if the posts are available, maybe it is not a matter for now, but those are the challenges that I would like someone to note. That's all for me.
Can you maybe tell us a little bit about the hospitals and the area there? You're based in Welkom.
Okay, I'm based in Welkom. This area is Lejuluputswa district. In Lejuluputswa district, we have one regional hospital, which is Bongani Regional Hospital, and we have 5 district hospitals. One of the district hospitals is in Odendastras, which is Tuzanon. We have a district hospital in Virginia, which is called Catleho. We have one in Worcester. We have one in Butterville, and we will have one in Winbeck. We got 45 government clinics that are feeding into these district hospitals and the regional hospital. Our regional hospital refers patients to the academic complex in Bloemfontein. On the private side, we have 3 major private hospitals in Welcome. We have the Mediclinic Hospital, and we also have Arish Machaben Hospital, which used to belong to the mines before, but is now owned by a different private organization. And then we have St. Helena Private Hospital. We are fairly okay with the bed space. Bongani, in terms of interns and community service doctor, most of the interns are based in Bongani Hospital with rotation exposure to the district hospital of Tusano Hospital of the Industries and some district clinics. So in the hospital in Bongani, we have specialists to look after them. In pediatrics, we have 2 specialists, pediatricians. We have a general surgeon for surgery, and then we have 1 gynecologist for obs and gyne. Internal medicine at the moment, the internal medicine physician left, and they're busy looking for another physician to replace. Bongani Hospital has is a recognized facility for COVID admission, and apart from admission, they have extra capacity to accommodate patients for COVID. And over the time, we have been able to assist the area with COVID admission, including outside our district. So I think we are fairly covered about the number of bed space that we have in this area. That's all I can remember for now.
Yeah, thank you, Dr. John. I think we should then move on to the next agenda item. Dr. Benjamin de Bruin is currently a community service doctor at Botshabelo District Hospital, also in the Mangaung Metro District, and is our current, what must I say, Judasa go-to guy. After I see one of our previous stars in that regard, Zazin Zama, is also in the auditorium. But yeah, Ben, if you will enlighten us on the Judasa side.
Right, thanks, Prof. Yeah, good evening from our side, and thank you also for the opportunity. As Prof Hagemeister said, I am currently doing my community service in Botshabelo Hospital. I've done my internship in Bloemfontein and also studied here in the Free State. So it will be my 9th year in the Free State this year. So I think we'll keep it short and sweet, but I'd like to start by saying that JUDASA obviously is the Junior Doctors Association of South Africa, and we are not separate from SAMA. If you are joined to SAMA, you automatically join JUDASA as well. We are clearly just an SIG from SAMA, or with SAMA then, of SAMA. So it's not a separate entity, it's not a separate
SIG? What is that 3-letter abbreviation for again?
I knew you were going to ask me.
A special interest group, yeah.
Yes, so you form part of the special interest group, which is the junior doctors. So from that, it's after you've graduated till your first year post-community service. And so I just wanted to make it clear that you do not need a special membership to join JUDASA when joining SAMA, and you fall in that, I want to say, age group, but in that demography of being intern, ComServe, and then 1 year post ComServe, you automatically form part of the JUDASA interest group. Obviously, that creates the question as to why do we need the special interest group? It's basically because there's special needs as well that are pertain to interns, community service, and junior doctors, which we all know. I don't really need to reiterate that. It has to do with placements, it has to do with salaries, it has to do with registration with the Health Professions Council of South Africa, which is probably a few topics that we've been busy with since the end of last year to a great extent. That's the biggest and most important thing. So from my side, I'll be the person on the ground, and why we need people on the ground in this interest group is exactly for the reason that in the Free State, we are placed in different locations. We are rather far from each other. It's not possible for me to know while working what's going on in Welkom or Kroonstad, and being a network of junior doctors on the ground, we get to have hands-on basis, and we can actually then uplift issues that needs to be attended to by the bigger body as well. The other thing is, when community service hits you, you tend to be placed in some very rural places, and you find yourself to be one of 2 community service doctors. When you then get into situations where you need labor law advice or any other ethical dilemma whatsoever, you need a body to be able to rely on and to stand on. And that is exactly what SAMA is there for. So for the junior doctor, the most beneficial values that SAMA also, and then JUDASA helps with, is obviously labor relations advice. If there's any grievances or disputes, or you need representation in unfair labor practices, whether it is seeking assistance in preparing for disciplinary hearings or advice on rights pertaining to the conditions of employment, SAMA helps with that. If you are looking to the more academical side, it provides you with access to journals and training opportunities. And then most of all, when you were studying, you were protected by a program director and a head of the School of Medicine and a dean. But as soon as you got your degree and you started working for the Department of Health, for instance, you tend to find yourself isolated and rather alone. There is group representatives and intern curators and everything. But in a lot of cases, we have experienced that junior doctors still feel isolated and still feel helpless to a certain degree. And that is where JUDASA comes in as well, to play a vital role in the fact that we can, as a body within a bigger body, stand up and voice these concerns. And I think it's also just valuable to say that SAMA is also a part of the African medical associations and a worldwide organization as well. So we have this congruent voice within a bigger body, and it carries a big weight once addressing issues. I think that's basically the core of it all. We are busy building up the structure for JUDASA, for the Free State as well, and we are very happy and keen to have people take hands and join us on a ground level, so that we can have voices and ears and eyes in our different district hospitals in the Free State to, in the end, better the whole service as well.
Yeah, thank you, Dr. Ben. I agree with you. One of the characteristics of JUDASA is that we are persistently busy seeing a new JUDASA being built, and then I think that is something that is also important for our young colleagues to understand. There is no fixed building, no fixed structure the medical association is a membership organization, and much more so, you know, in the elder league, and I've recently kind of retired into the academic doctors association. You know, you have people hanging around for a couple of years, but in the junior doctors association, owed to the relatively short turnover times, you know, 2 years of internship, 1 year of community service, and then usually people move geographically, move into other kind of activities. So there is a persistent need and a persistent openness as well from our side for new people to come in and to engage and take over and carry on, or to change maybe sometimes the focus as well. So please, as again an invitation, come in, join in, bring your own ideas, bring your own enthusiasm, bring your own problems, and help us to see an ever renewing, ever young Judasa, developing and reinventing itself.
Yes, so I think also I've asked Renier, my contact details will also be available to the attendees. To both, I will assist them with joining SAMA, and then also connecting them with the Judasa communication networks that is applicable to the situation.
Excellent, thank you. Yeah, then I would suggest we move to the next agenda item. Dr. Achter, now you are an agenda item. No, you are you are an well-esteemed colleague and friend, and we have spent many a year already together in the medical association, addressing a lot of exciting matters. Gaining a number of exciting experiences as well. So please, Dr. Hussain, over to you.
Thank you, Professor Hagemeister. I'm very excited to attend this webinar, especially Bloemfontein Sama branch. I also like to give my greeting to our national chair, Dr. Angelique Kusia, and Judasa leadership and the branch members, and all the new colleagues from interns and community service and medical officer specialists, giving me an opportunity to discuss with you. I just saw my video is not coming up, but I will keep trying. I just have to give a little bit background, and I'll go on what we are doing as a medical association, public and private sector. You all know South African Medical Association is a more than 100 years old organization. And before 1994, it was MASA, Medical Association of South Africa. But after independence of South Africa, the new unity name came, SAMA, South African Medical Association. Then during this process, SAMA became also affiliated with the World Medical Association, and we have been also associated with the African Medical Association. SAMA has a responsibility to represent private sector doctors and public sector doctors. We have been doing all the public sector labor-related work, and we have been registered with the Labor of Registrar Office, and we were recognizing ourselves as a union with the affiliation of Democratic Nursing Association. And DINOSA is a nursing organization, which is our affiliation memorandum of understanding with them. On the professional side, we support each other. Even they give us a seat to have a bargaining council. And in fact, we as a SAMA want our own bargaining council. And SAMA has been doing exactly what any trade union doing, and we have been doing every labor related work through our expert in the industrial relation, labor relation committee team. In public sector, we have taken an oath. That's a serious oath as a profession we have taken, and we are a professional essential service in the health care. So many other militant activity we cannot do or embark. So we always follow our mission and vision to united voice for our doctors. So we also aim for best policy for our patients in the healthcare and the future of the health for all. According to the level of registrar, there was a dispute. You have, most of you know about it, that Sama didn't fulfill labor law, all the requirement. It was not possible to fulfill labor law according to the militant labor organization because we are a professional organization. We have public sector and private sector. So we were doing exactly what public sector doctor need, and we have been providing that. So SAMA is the only professional organization in South Africa. And it got a big responsibility to look after public sector doctors and private sector doctors and their challenges. So our goal is to protect our profession and our member. If you remember, we all signed SAMA form to join a SAMA professional body. We don't sign our form as a trade union form. And the fees we get as a membership fee we pay, that is the professional fees we pay for professional activities, like we get a journal, continue medical education, CPD program, human rights and ethics issues, health policy work, research, bursary, scholarship, many publication in SAMA, mini training, short-term training, short courses, clinical courses we provide with the alliance with the FPD and MPS, which is the Medical Protection Society, who also do the courses for ethics for our junior doctor, senior doctor. So we have very good coordination with FPD and MPS. All those courses are free for doctors. You just have to look at the calendar and follow. And especially in public sector, we represent with our legal work in the CCMA, even up to the bargaining council. And we look after all these doctors' challenge, workplace or salary issue, or even promotion or any other dispute arrive. Issue of EPMDS, as an intern, you don't do it now. Maybe there's a one only form to fill. But as you become a community service and medical officer grade 1, you need to do EPMDS performance agreement with the Department of Health. We also fight for the shortage of posts in doctors and doctors' working condition. Recently, Limpopo had a circular that they're not going to appoint doctor as a normal contract. They will give them a contract of a contract doctor, means shift doctor. You will do 8 hours, some day shift or maybe night shift. So you don't get other benefit as a full-time doctor. As a SAMA, as a public sector group, as a whole SAMA, we fought for it. We have written a letter to the Minister of Limpopo Health Department. I have just received that letter this week. They have withdrawn that circular because it was unfair implementation, signing contract for shift doctor work. Shift working doctor is only work in the factory, not in a medical profession. If you want to bring changing working condition, you need to negotiate with the doctors. If we agree, there will be a terms and condition, because it don't just go and sign. And we also talking about salary. What salary we've been getting, that is, our salary is only good with the overtime. If you don't do committed overtime, your salary is not up to the market related. So that is OSD phase 2 negotiation because of the COVID-19 and so other financial challenge. We still waiting to start that negotiation. Other issue is to join or not to join a SAMA or any union or any organization. Choice is yours. As a medical profession, from the junior doctor to the senior doctor, I think you have right to decide which organization we will join. But in South Africa, there's only one medical profession who look after doctor interest, who represent doctors, who do the advocacy, and it is only South African Medical Association. If anyone think they want to join trade union or any other union, they are free to join. But remember, this other trade union, they don't represent doctors. They represent mass number of workers like a general assistant, hospital clerk. So their issues are different. Our issues are totally different. So the choice is yours, but is the only SAMA is the voice for doctors. If someone detecting your personal deduction from your salary for trade union without your permission, that is illegal. They cannot do it. You must immediately terminate those deductions and you sign for SAMA debit order. That is the legal way to do it. It is not true in the area in a public sector that doctor, you have to pay a fee for union. There is a rumor, I am getting phone call that you have to pay for a union fee. No, you don't have to pay any fee or anyone can deduct your money. The fee is deducted from your salary 104 Rand. That is deducted from your salary that go to the bargaining council, and the bargaining council, that 104 Rand, which is universally detected from every public sector doctor, that will be only distributed to all the union in small amount that look after the salary negotiation and working condition of the doctors. So those are the issue. We don't take that money. That SAMA fees is a small fees for junior doctor, intern, and CSO. Only when you become a medical officer, the salary, the membership fee change. Otherwise, interns fees are very minimum, and 104 Rand, it don't come to SAMA, it go to the bargaining council. I think this was the lot of question was asked before as well. Because they do negotiation for salary, that's why they have to distribute that money to all the union work. To remain as a medical professional, to your part of, you need a dignified medical association. So you need those activity through our medical association. If you look at what happened outside South Africa, American Medical Association, German Medical Association, British Medical Association, they are all professional organization, and there are no trade union in the medical association in other country. They are the biggest lobby through the chamber, through the Senate, and that's how SAMA we are thinking to, we are planning and already started doing through the minister, through the director, DG health level, portfolio committee level. So as an employee doctor, we're trying to make sure everyone 2,400 intern placed, and those who haven't got still placement, we are fighting. We are negotiating with Department of Health, National Department of Health. They are cooperating with us. So far, the list, some are member given to us from different province. They have appointed, allocated all those interns and community service. There may be some challenge. Those interns didn't get placement. Maybe some documentation or the first block didn't get clear. That's why maybe the name is not reflecting for placement, or there is a delaying in the Health Professional Council to get the IN number for intern and the community service registration. Because of the COVID-19, everything was online. There is a delayed registration, but they have promised us if your documents are right and they are delaying, please contact SAMA. You can contact through your Bloemfontein branch. You can contact SAMA Labor Relation. You can contact SAMA membership direct to us. We are receiving every day all those list and name and complaint, and we act rapidly on those placements. Last week, almost 70 or 80 doctors' salary was delayed paid, but they make sure last week they paid within 24 hours. The rest of them, they are getting paid today. And those who haven't got paid, they promise that before 28, they will get paid. So if anyone got their partial deduction from their salary, colleague, you need to terminate those partial deduction from your salary. You write a letter. You don't want your money to be deducted from your salary. You give that to the HR office, and you send that copy to SAMA, email to us, or give it to Dr. Professor Hagemeister. And in a public sector, you need 3-month notice to terminate. If they don't get terminated, we got our lawyer, our legal department to represent you, and they will make sure that your money is not going to be taken away. How we do public sector representation, we had got our labor relation advisor, we got a lawyer in our department of SAMA, and we got a labor advisor, we got a employee relation advisor. So we meet, we discuss, we take every case by case and challenge the Department of Health, whether it's a medical manager, whether it's a clinical manager, whether it's intern supervisor, or the CEO of the hospital, or DDG of the hospital, or provincial minister of health. As I told you, Limpopo, we have taken that minister. And if I have to go to the national minister, we'll go. If we have to go to the president of this country and doctors are suffering, we will approach there. So you don't have to worry that how SAMA will represent. SAMA will represent you in every level. So make sure you fill the correct SAMA form and debit order. Make sure you become a SAMA member to gain all those benefits. There are many, many benefits. SAMA is got a big list of benefits, even the housing loan, buying a car, all those benefits are there. I think HR, we will ask HR to circulate those to our member. I think if any question, or I will just, last point, legal side, those members still getting deducted and their intention is to remain SAMA professional member, and the salary, the membership fees deducting from the salary, we are embarking a class action against those hospital HR, which is not terminating and not following the rule of labor law. We are going to put our attorney on these issues, and that will be very soon. We are embarking that process. I will stop here. If any question regarding public sector or private sector, I will be happy to answer. Thank you. Thank you, Chair.
Yeah, thank you, Dr. Rechter. Yeah, as you have elaborated, we are in exciting times. We are reinventing. There you are. Welcome to Durban.
Yes, it didn't work all this time.
It was just keeping the best for last now. Yeah, now that we are in the process of redefining public sector employment advocacy through SAMA, I think we have learned quite a few things over the last couple of years. And one of the things that we did learn was that the armament, the quiver of interventions that the Labor Relations Act provides for organizations registered as trade unions are probably not appropriate and not particularly helpful in our particular situation as medical practitioners. And you mentioned the restrictions, that we should not, that we must not, and that we probably don't want to either go on strike. So, which is one of the big hammers in the quiver of trade unions. So we need to find other ways, and then I think I'm confident we are in a process there, finding ways to advocate for the interests and the needs of the medical practitioners in this way, and under your leadership in the employed doctors setting. Yeah, that takes us to the question and answer setting. So I see that our colleague Dr. Zama has asked, I've heard someone speaking about being a shop steward for SAMA. Could someone please explain to me what a shop steward is, their duties, and how do I become one? Akhtar, will you help us in that regard?
Yeah, thank you very much. Very important question. Shop steward basically is a terminology is coming in a trade union, which is in the ground of the grassroots level activity. In a medical profession, we have been trying to appoint health advocacy member or a health activist. And last few years, we have been trying to do this, and we start the training for our health activists in each hospital. And if you got 10 members in a hospital, we can have one health activist. If we can have a 50, we can choose 5. Basically, it's a leadership position within the clinical and your medical practice domain, and you are between your member, your colleague. You are representing your colleague on the grassroots level. Then, if it is not resolved within the institution, shop steward can go to the district level, higher level, provincial level, then it's a national level. So basically, shop steward, we are planning to elect or nominate in every hospital. That work we started before COVID-19 and somehow didn't progress because we can't go physically and do that. So those who are interested in health activists, they will get a training. This is the way to develop your leadership skill as a long-term process. Yeah.
Yeah, and then also from Dr. Zama, he refers to the issue of moving from one province or from one side to another. I think that's something that happens already if you became a SAMA member as a medical student and then move on. So he asked as well, if I become a member during the internship and then move on to another province. So how best to liaise with SAMA about moving from one province to the other, being at a new site. How do our members make sure that they remain in touch, that they remain members in good standing as well if they need assistance at some stage?
Yeah, this is very simple. Once you are a member of SAMA as a student, when you finish your MBCSB 31st of December, you finish your student membership, then you 1st January, you become a Judasa SAMA member. So you are a junior doctor's member from day 1, 1st of Jan, any year, whether 2021 or 2022, you will be a member of SAMA. Then you continue. Only thing from Judasa, you progress to Sidasa, or you go for registered training, you become a SARA, or you want to go for a research or a military or private practice. The name just changed. You remain a SAMA member, and the moment you move from one province to other province, you just need to inform membership department, log in, change your address, corresponding address, mail, and that's all. Nothing else you need, just need your address to be changed.
Okay. There's also a comment on the nudge progressions that I mentioned earlier, and I think it would probably be a good start for our engagement with the interns. I quickly looked up now in the current salary table, which is the one that came into effect on the 1st of April 2019. As the colleagues know, we did not have a cost of living adjustment, no changes in the salary table in 2020. And I would like to ask the interns, the first year interns should see on their salary advices that they get. And in the right upper corner of the salary details, there is a field that says notch. So the first years will be in the 500 and 1,000 notch, which is the first year intern notch. The second year interns should have received a increase and should now read on the salary advice a notch of 504,246. So if you want to do the little check as second year interns, if you want to have a look whether you are in the 504,000 band or whether you're still stuck in the 501,000. If that's the case, as I said, we'll be more than happy to assist and engage with the employer on those matters, because that's what unfortunately does happen. In many cases, we have seen that those salary adjustments that are meant to be an automatic process have not been implemented. So we'd like to encourage people there to scrutinize their documentation and see whether the employer is playing fair, or whether we need to intervene, because now, after all, these are agreed upon salary levels, and it's not up to the employer to decide whether or not you receive your notch progression after a year. So let's. Do you want to say something about that, Dr. Hussain, after?
Yes, sure. It's very important. Our interns and com service and MOs, any senior doctor, they must take the salary slip from the HR every month and sign, and make sure you see your deduction, or sometimes you won't see your notch progression, grade promotion progression, and it will be too late by the time you go back. It's already 3, 4, 6 months backdated. So salary slip every month, please sign. And it's a requirement for DOH, because just not taking the salary slip, it means they can tell you are a ghost worker. they can come back and do some other implementation. So that's the one advice I will say, make sure you go and sign HR office, take the salary slip, check your deductions, check your all this pension and what going through. Is every month same salary or some month you're getting less? The second issue, 31st of March or 30th of March is the last date for HPCSFP. So all the interns, first year, second year, ComServe, please check how much you have to pay. Don't delay payment for HPCSA. Otherwise you will end up paying penalty or fine, extra money. So just reminding. Thank you.
Yeah, thank you for that, Dr. Akhtar. Yeah, that's one of the common challenges that we have, and we discussed a little while back that for the future we also want to provide guidance to the young colleagues as to what the necessary steps are when you get into employment with the state, because what we have seen, there's often a lack of support and guidance from the HR department, and then you will be caught up and at some stage found wanting, or you'll miss out on timely payments, for instance. And as Dr. Akhtar mentioned now earlier this year, in particular due to delays that often were beyond the control of the universities as well, when the entire examination process and the finalization of study results took time, and then the engagement with the Health Professions Council again was delayed, and the processing of the applications for registration in the categories as intern. And then our young colleagues were not able to submit their required documentation to the HR departments at the sites they were allocated to, and that again, then led to delays in the process of capturing their details. So what we resolved to provide in the future is a kind of little outline, the timeline of events, the documentation. You all probably recall the need to run for a bank letter, to prove your account details, so that we can facilitate and assist there in avoiding unnecessary delays that then inevitably result in salaries not being paid. Yeah, as Dr. Akhtar emphasized, there are certain rules, there are certain things that need to be complied with in the public sector that cannot not be ignored or ruled. So we, as public sector employees, need to play by certain rules, so that we then can expect as well that we do get in return the appropriate salaries at the correct time. Yeah, on the question and answer, I don't see any more questions coming in. Last round, last call, last opportunity for questions. What you're saying, an auction going, gone?
Okay, if no question, can I add few advice there?
You're most welcome.
Thank you, Chair. Thank you very much, Prof Hagemeister. Yes, I forgot about safety and security for our doctors. Accommodation challenge. Please contact us if you got any problem issuing. I know Polonami Hospital 3 years ago, we have a lot of safety and security challenge. And I'm sure it's not only Bloemfontein, it's most of the public hospital, safety, security, accommodation, training issue, rotation issues. we are there to help you. We just have to provide the evidence and the shortage of doctors. And interns are there to work 26 hours in a stretch, 40 hours per week, 16 hours per week for a call. And if they are post-call, they are allowed to go 12 or 1 o'clock. It depends on the each department. It's nowhere you can do more than 80 hours, 80 hours your overtime per month, and more than 40 hours per week. If there any challenge, we can HPCSA to inform. We can inform the HPCSA, and especially second year intern who are rotating through the family medicine, they need to also inform to HPCS or SAMA how they are training, supervision, or they are themselves running the whole hospital. So we need to know all this issue and the working condition. Thank you, Chair.
Yeah, thank you, Dr. Akhtar, for this. It's a very important point. Yeah, sharing with you the experiences in the internship evaluations. I mean, the new pattern for the second year internship has been hit by a perfect wave. The rollout happened now. The preparation was happening in 2020, and all the good intentions that we had from the Health Professions Council subcommittee there could not materialize because of the restrictions and us basically not getting to the sites that were meant to be visited and physically being inspected. So now more than ever, there is certainly a need for an open channel, for an open ear on our side as well as to what problems occur there. You mentioned the accommodation, the security issues, but also the supervision, so that yeah, where due to physical constraints in terms of site visits, and that the oversight and the accreditation process by the HPCSA has been hampered, we need to come in, and if there are shortfalls, yeah, certainly again the invitation to use this platform, to use the medical association, to use the contacts to the colleagues and the network that we have to address these matters. And if you address us in confidentiality, you know, we will certainly honor that as well. I know it's often a challenge, you know, that interns in particular with the need of being signed off for their training rotations in the different clinical disciplines feel very vulnerable, you know, and rather swallow things that are far from optimal in an attempt to not be seen as troublemakers or whatever you wish, and therefore huge problems go undetected. And therefore, as I say, if there's a need, you know, if you want to contact branch council members, SAMA representatives in confidence, you know, you're more than welcome. Just let us know, you know, that you fear certain things, and then we'll, to the best of our ability, honor these concerns as well. But yeah, if we don't learn about the problems that exist, we need networking. We need input this time. I saw, and we discussed it in our advocacy group as well. The Health Professions Council now has suggested that we do the site visits virtually, which might again hamper and restrict the ability of the HPCSA accreditation process to pick up problems. So please let us know if there are issues that need to be addressed, and trust us that we will intervene, and that we will seek ways to to protect you, but also to improve your lot in those settings then. Okay, I don't see any more matters having been raised. So if is there any more comments, contributions from the panelists? Dr. Benny, Dr. John, comments from your side? Matters,
Prof, I don't have additional comment to make on my side.
Okay, thank you.
Also, nothing from my side. They're welcome to contact me if there's anything I can assist with.
Thank you, Dr. Benny. Well, that would then conclude our program, our agenda. And as per agenda, I would then hand over again to our national chair of SAMA, Dr. A Coetzee, to conclude the session. Dr. Angelique?
Thank you so much. Let me just put my glasses back, otherwise I can't see anything. I can't even see you. I think this was a very nice meeting, very informative, and you had some good questions. I think we need to have this type of information session at least twice a year, because there's such a lot of things that are happening in the background. And we are also learning, you know. I'm always very glad for someone like Dr. Hussain, because if I don't know, I will always ask Dr. Hussain for his advice. And I will say, Akhtar, please help. As it is two worlds, and you need to understand that you are protected still as interns, you are still protected as ComServes. And then maybe if you stay in the hospital setup, a public sector setup, you will still in a way be protected. But there will come a time as a medical officer where your protection can only get this far. And then you need the wisdom and the insight to know what to do going forward. Once if you decide then to leave the public sector, go into the private sector, I can promise you it's a total new ball game. There as well, you need guidance. And there, from our side, I can always say, I can give you a lot of guidance in what's happening in the private sector. But for you youngsters, the two people here, Dr. Hussain and Prof Hagemeister, they have the experience from the public sector side. You need mentors. No man is an island on himself. You've got, I know on UDASA side, you've got great young guys there as well. And once if you are getting my and Dr. Atka's age, you will maybe understand why we say you need sometimes mentorship for people who have been through everything, who're still learning. We are still learning on a daily or on a weekly basis. And once if we think we have sorted it, and the next curveball is coming in our way, and then we start all over again. So please, from my side, and on behalf of the board, I would urge you to please communicate as well with us. And remember, you are SAMA. I'm not SAMA. SAMA is Dr. Hussain, Prof Hagemeister, Dr. de Bruin, Dr. Sazi. It's all, that's SAMA. SAMA is not the building. You are SAMA. And it's not all easy. Guys, I promise you, it's not easy. And it's quite hard out there. But you do have a team. I always call it a family. You've got a family that you can come up. And yes, you will hate us sometimes and say that we are not listening to you. And we will say, damn, these youngsters, they don't know anything. But that's life. And then we come together again and we take hands and we carry on forward. And with this few words, I just want to say, again, stay safe. You've got great leaders in Prof Hagemeister and Dr. Hussain. You've got great youngsters. You've got a Sama family. Please, let us take hands and walk the talk and see how far we get. Thank you so much. And thank you for taking your valuable time tonight to attend this meeting. And I will ask for a follow-up meeting. Thank you all. Dr. Hagemeister, over to you again. Prof.
Yeah, I think that I'm slowly getting used to not looking over my shoulder when somebody calls Prof. So trying to figure out who's standing behind me now. Yeah, I think we have covered the matters that were at hand. We have had and given opportunity to address and raise matters, and yeah, therefore again it remains only now to thank all the participants, our young colleagues that might have dragged their tired minds and bodies back into the in front of the computer screen. Many thanks for that effort, and I hope we honored that effort and made it worthwhile your time. Thanks again as well to the panelists, to you, Dr. Angelique, to Dr. Achter, to Dr. Benny, to Dr. John, and the technical team in the background that set up the meeting, that assisted us with the administrative parts, with the invites, with the registrations, making sure that people got the message and got an opportunity to join. Thanks also to those to the branch council members here from the Free State. I see Dr. Chantal, others being in the yeah. So that from my side concludes this event, and I wish you rest well. I hope some of you enjoyed the weekend. Those that didn't, yeah, hopefully will make it to the next weekend inside. And then yeah, talk to you again soon. I'll be happy to respond also to personal contacts if people approach me. I see some of the Bloemfontein interns here, the community service doctors, and yeah, as you said, we'll do it again. Thank you for that, and have a good evening.
Hi, good evening. Thank you.
Bye.
Thank you.